So today we're going to talk about HCISSP and the certification examination and HIM. So health information management has really four parts to it. And this may not exactly be the scale, but if you take a look, depending on the circumstances, you have to have proper disposal methods to include the following. So you have disposal methods of health records. So you have basically shredding of PHI so that it's not recognizable. You have maintaining PHI for disposal in a secure area. It has to be secure. And based on the size and type of the actual entity, depositing PHI in boxed dumpsters and locked dumpsters can be permissible. And for PHI on electronic media, you have to clear it, purge it, and destroy. So that's sort of one thought process, which is sort of the disposal thought process, has to be very carefully looked at. Now, if you remember, one of the main causes of breach is this disposal process, which is improper. So this has to be very well maintained. Now, if you take a look at how you properly manage and safeguard it from the start, you need to basically have specific organizational, jurisdictional, and regulatory data retention requirements. So you need to be able to comply with HIPAA, of course. So it's sort of 1996. And you also need to take a look at the quality of your electronic health records. So the quality is, no cloning of your note, tell the patient's story, don't copy and forward, and no copy and pasting, vital signs. So that's the quality. And Medicare, Medicaid is getting a little bit more strict in this area. So we've talked about, talking about HIPAA, we've talked about disposal process, the creation process, and then in between all of these processes, of course, is maintenance. The servers on which it lies have to be secure, and the databases, as time goes on, deal with data integrity, and this will ultimately lead to your clinical trials. And if you have a great deal of discrete data, that will drive evidence-based practice.